All right. Hey everybody, I'm at a new location tonight because our Hatfield office. So it's a little bit louder. It's inside a massive warehouse where there's flag football all around us. So you're going to hear some bells, some whistles, some beeping. Apologize for the noise, but this is where we wound up tonight, so this is where we're doing our Facebook Live. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're talking about SI joint dysfunction. What is the SI joint? It is the sacroiliac joint. So, SI, sacroiliac. The sacrum sits here, it's your tailbone. The iliac sits here, it's your hip bone. Put your hands on, okay? So that comes together and there's a joint. There's two of them, one on either side, right there. It can cause a lot of pain, and the problem is it doesn't really show up on X-ray or MRI. The joint itself does, but if there's dysfunction, it doesn't really show up on the X-ray or the MRI. So this is where we really specialize in treatment because this pain can be debilitating. So how does it happen? Well, first of all, it can happen in childbirth. As the baby comes out, right here always gets affected. This can get what we call stuck. It becomes difficult to move. How else can you do it? You can jam it by stepping down a curb, stepping off a step wrong. Anything where you're doing this one-legged step down, you can actually cause it to jam up. Sitting for too long, that can cause it to have pain. And there's a bunch of other reasons, but those are some of the main ones. So this is not something that's a traumatic injury. Generally, we very rarely see it in traumatic injuries. These are type of injuries or the type of pain that we see that happens when you're like, I don't know what I did, but I have a pain right here. That's the most common description of an SI joint pain. Now, you may have pain also going down your leg. You may have pain going into your thigh. You may have pain in your butt. But literally, the SI joint generally presents as, I have pain right here. Maybe it spreads, maybe it goes down, but there's always an underlying pain right here. It doesn't matter which side. But you can always pinpoint to one spot where it's like, that really hurts. That's the SI joint. Now, if the pain is lower, like in your butt, that's different. That's the piriformis. That's not SI joint. That pain is more down here. The SI joint is up here. It is at the top, and here's your tailbone right here, right there. So if you can take your finger and go, I have pain right there, that's an SI joint dysfunction. Doesn't mean there's not other things going on, but there is that SI joint dysfunction. So how do you treat it? Well, first of all, you got to figure out, is that the only thing going on? Second of all, you have to get it moving again. So a lot of times what you're going to need to do is you're going to need to basically do a lot of just almost sit-ups. You can be sitting, you can be standing, all right? But you want to just kind of tuck your pelvis under and then bring it back. Now these are very simple exercises, and let me tell you something, this may not do it for you because of the position that it's in. You may need hands-on physical therapy to get this back to where it needs to be. That's what we specialize in. If you want a free consultation, all you have to do is call our office at 215-997-9898. We'd be happy to check you out. But you want to try and do everything you can to kind of get it to move on its own at home. Next thing you can do, and again, I'm showing these standing. You can do these lying down. You can do these sitting. You want to bring your one leg up to your chest. All right? I'm showing you these in various positions because you want to do these throughout the day. This is not a one set of 30 and you're done. Especially if you're feeling pain. You want to really try and open this up throughout the day. So you're just doing nice and easy, bringing your knee up to your chest. You don't have to hold it for any particular length of time, but you do want to just make sure that you're bringing it up as high as you can. If it's painful, then don't bring it up as high. Bring it up to where you feel comfortable, but not painful, all right? And the last thing you want to do is you just want to put your hands kind of like right on either side of the SI joint, and you want to lean back, okay? Almost looking at the ceiling, just lean back nice and easy. Again, hands here. If that causes you pain, if that causes you numbness and tingling, you want to stop. Those are just 3 basic exercises to get you to start to move that SI joint that may be uncomfortable. But this is a very big cause of low back pain that rarely is addressed. And unless somebody gets your hands on you, somebody who knows what they're doing, and really helps that joint along. It does take a lot of time to actually get it to fix itself at home. There also might be a leg length issue. Maybe you say, I think one leg's shorter than the other. That comes into play when you have an SI joint issue. So there's a lot of things that can stem from this one little joint that is going haywire. And like I said, you're not going to see it on X-ray or MRI, so it's very difficult to say that's what it is. Somebody needs to get their hands on you and really figure out what's going on. If you or someone you know is suffering from back pain, or you think you have an SI joint problem, and you want a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks and have a good night.